L4-5 disc herniation can be a painful and frustrating condition that often leads to serious chronic lower back pain, to sciatica-like symptoms like sharp pain radiating down into the legs. It can lead to muscle weakness and limited mobility in the lower body. It can make everyday life a challenge, leaving you in constant pain, limiting your ability to move freely, and even impacting your work, social life, and mental well-being. Hi, I'm Dr. John Zalanka, a neurofunctional chiropractor in Ottawa, Ontario, Canada. If you're dealing with lower back or leg pain caused by an L4-5 disc herniation, you'll want to stick around because this video is for you. Today I'm going to show you 5 simple exercises designed to target the lower back, and they'll help relieve pain specifically caused by an L4-5 disc herniation. These exercises are safe, effective, and you can do them right at home without any special equipment. By the end, you may find that your lower back pain, stiffness, and leg pain improve within just minutes of trying these moves. Let's dive in. All right, exercise number 1 is going to be what we call the cat camel. So the cat camel is a stretching movement. We want to add mobility. You know, a lot of people, when they're suffering from an L4-5 disc herniation, they're going to have a problem with mobility. So Tanya is going to get into position for the cat camel. And so it is so named because you're going to make a move like a cat followed by a move like a camel. So you can see we start with the spine straight. Then Tanya is going to arch the back, okay, to the point where she feels a good stretch. Okay, that old adage, no pain, no gain, does not, never has, never will apply to stretching. And then from there, she's going to go the exact opposite way. Now, be careful with this. I need you to pay attention to what's going on. I know that sounds almost silly because there's so many exercise videos out there. Stretching is not something that should just be without thinking. We want to think of what we're trying to accomplish. And now we're going to go back into the cat position again. The whole idea is we're trying to get mobility back into the spine because with an L4-5 disc herniation, there's going to be a lot of stiffness in there. If we can get some more movement, that's going to be better. But if you get to the point where it hurts, you need to back off on that. As I said, the no pain, no gain does not, never has applied to stretching. Okay? And then again, back to the next movement. When we're doing this, we want to breathe. So a lot of people, for some bizarre reason, like to hold their breath. Breathe normally while you're going through these movements. You should feel a good stretch, good movement in there. Okay? And then again, reverse back to the next position. Okay? We'll do that one more time. Up. And then we'll come back down for one more this way as well. Okay, and think of what we're doing. We're getting movement back into the pelvis, back into the spine as we do that. Exercise number 2 is going to be what we call the seated pelvic tilt. The reason we want to do a pelvic tilt, again, is for mobility. A lot of people, again, with that L4-5 disc herniation are losing that mobility. So when we talk of the pelvis, this is your pelvis. It's what everyone thinks is their hip. When you were a kid and you were in gym class and they said, put your hands on your hips, everyone was really putting their hands on their pelvis. And we want that pelvis to be able to move forward and backwards as well. So we're choosing a seated pelvic tilt just to make it that much easier for you. So what we're going to do again, okay, in the pelvic tilt, you're going to see that first Tanya is going to arch backwards. She's literally moving the pelvis backwards. Okay? And then she's going to hold that. And then she's going to go the exact opposite way. Now again, just as we were talking about before, is pay attention to what's going on. You know, it's this whole idea, we mentioned this, it's not the no pain, no gain type of thing. There's a difference between what we call a good hurt and a bad hurt. You're going to come backwards again now. So a good hurt is one where you're doing an exercise, you're going to feel it a little bit. That's perfectly normal. That's a hurt pain. A harm pain is one where you are either causing a sharp pain, or you're causing numbness or tingling or pins and needles, or you instinctively know that you're doing damage in there. You back off that right away. Okay? So you can see Tanya's continuing to go back and forth. The reason I've picked a seated pelvic tilt is understand so many people feel they have no time to do exercise. Well, guess what? A huge percent of the population spends their life sitting. So you can do this even while you're working. And the whole idea is if we're already in that seated position, why not get some movement into that? That's going to start to free up that pelvis. That's going to get us more mobility, more movement, and so forth. And you can do this as many times a day as you want. People are always looking for how many sets and how many reps and so forth. This is something, the more I have movement, okay, both in the cat camel and also in the seated pelvic tilt, the better off that's going to be for my spine. Exercise number 3 is what we call back extensions. Now, this is important to understand. Again, as I said before, we want you to think about what you're trying to do. So some people think that they're going to avoid an extension because if the disc is bulging out backwards, they don't want to put more pressure on the disc. It actually works opposite to that. So think of a jelly donut. If I squish the front of a jelly donut, that's going to cause the jelly to push out more on the back side. So that's why often back extensions can be beneficial for disc herniations. Again, you want to take them to the level where you actually feel that you're doing something, but never to the point that it causes any excessive discomfort or pain in there. So in the back extension, you're going to see Tanya's just literally going to extend backwards. And in this case, you can start something as simple as just staying on the elbows. Don't make this difficult. You don't have to be the super duper yoga person who looks like there's some contortionist and so forth, just to the point where you're actually contracting these muscles. The idea is to take pressure off that disc in there. And again, take it nice and slow. And then you're going to repeat this, okay? As you can see what Tanya's doing. If you really want to get advanced, you could get to the point where you then go on outstretched hands if you like. For some people, that's going to be too much to start with. But again, just take it nice and easy. Pay attention. Don't forget to breathe when you're doing these as well. Okay? And I want you to focus on what you're feeling. It's not just going through the motions. We all know people who spend hours in the gym and years later look exactly the same because they just went through the motions. I want you to actually think about what you're doing. I want you to feel that you're accomplishing what you're doing with every single movement. This can be done as Tanya's doing it on one of our adjusting tables. It can be done on the floor, on a mat. And what we're trying to do is we're trying to get some strength back in there as well. We actually want to get some strength into contracting those muscles. Plus, we want to start to take some pressure off that disc as well. Okay, we're on exercise number 4 now for L4-5 disc herniations. Really works for all disc herniations in the lumbar spine. This is one of the key things. Again, I don't want to sound like the broken record, but there are different exercises for different conditions. So with the bird dog, what we're trying to accomplish now is if you're suffering with an L4-5 disc herniation or any type of disc herniation in the lower back, is a lot of people have lost not just the muscular strength, but they've lost what we call muscular endurance. So that's what a bird dog is meant to be, is we're trying to get endurance back in the muscle. So we get into this position, and then you're going to see Tanya's going to actually raise one leg, and then she's going to raise the opposite arm like that. She's going to hold that for a good 5 or 10 seconds, look at the balance that she has, which is great. Then she's going to switch to the other arm and the other leg. Now notice when you do that, you need to be contracting the core. Okay? If you're not, this is also very much a balance test for you as well, is you need that contraction of the core to be able to maintain that. So we're looking for balance, we're looking for contraction, we're looking for endurance. People who sit in front of a desk all day long, they don't need super muscle strength, they need muscular endurance. So, when you sit in front of the desk, you don't need to be able to squat 500 pounds. What you need to be able to do is to be able to hold your spine in that position over your day. Okay? And that's assuming you're obviously taking breaks as well. So again, you can see we're moving from side to side. Every time we do that, we're contracting the glutes, we're engaging the core, we're engaging the abdomen. You're literally trying to pull your belly button up and in, and you're doing all of that while you're breathing to get some muscular endurance back here. If we have more endurance to the muscles that support the spine, that's going to help support you with your everyday activities as well. Okay, we're going to do that a couple more times. And again, look at the focus and contraction it takes to do this properly. If you find that you're moving all over the place, then you may need to step down to an easier exercise to actually just deal with getting some contraction in the glutes to actually activate glutes that have become what we call inhibited, where the brain has literally shut them off. If you're someone with chronic back pain, chances are you have messed with your brain's ability to contract these muscles properly, and that's when we get into what's called neuromuscular re-education. All right, and exercise number 5 is what we call the forward full body tilt. Now this is going to seem strange to some of you. It is very much an exercise. So what Tanya is going to do is, to see how she's standing up perfectly straight, all she's going to do is she's going to tilt forward while keeping the entire body straight. What that does is that activates the muscles in the back. It also tends to activate the deeper, what we call multifidus muscles. And you just go as far forward as you feel comfortable doing, so that you actually feel those muscles have to stop you from literally falling forward on your face. But notice when we do this, you're not flexing. Okay? So this is one of the key points we made in the other videos, is ideally exercises need to be prescribed specifically to you. So it's great that we do these exercises. That's why I take such care and making sure as much as possible that we get exercises safe to you and specific to you. But for instance, an exercise for someone with a disc herniation is the exact opposite movement of someone with a central stenosis. So if you have a central stenosis, it's actually good to flex forward because it opens up that area. If you have an L4-5 disc herniation, flexion is what's going to be that jelly donut that pushes that gel backwards and actually aggravates the disc. So ideally, go and see someone who really knows their stuff well, not just any health professional who says, oh yes, we do the standard exercises for the average person. You're not the average person. And then where it becomes complicated is, what if you have both of those? So again, that's why ideally go see a good professional. But when we're doing this, you can see when you come forward, you're now asking all those muscles to contract, otherwise you would just be falling flat on your face. And you hold, for 5 or 10 seconds, and you can go back. And here's the neat thing, you can do this exercise everywhere. Now, you could be standing in line and just actually leaning forward. Okay? But again, it's got to be part and parcel of all the exercises we're doing as well, because while this is going to stabilize and help to give some muscular endurance to the deeper multifidus muscles, what we want though is we don't just always want to do contraction, we also need that flexibility. So that's why you had exercises number 1 and number 2 as well. Now I want to hear from you. Which exercise did you find most relieving? Was it exercise number 2, the seated pelvic tilt that restored some mobility into the pelvis and lower back? Or was it exercise number 4, the bird dog, that actually helped with muscular endurance? Please leave a comment below and let me know. If you found value in these exercises, do subscribe to my channel now if you want to receive more strategies for relieving back and neck pain naturally without drugs or surgery. I post a new video every week. Also, like and share the video because it helps support my channel and so that more people who suffer with L4-5 disc herniation can watch these exercises. The next video you should watch is this one, where I show you a unique non-surgical treatment method for L4-5 disc bulges, herniations, and pinched nerves. This method has helped countless patients successfully relieve pain, regain mobility, and avoid surgery. Please go watch this video next.